So if you're not subscribed to my channel, please hit the subscribe button, hit the notification bell so you can get all the notifications when I go live here on YouTube. I am doing something different tonight. I'm simulcasting on Periscope as well. So we are not only live here on YouTube with you guys here in camera A, in camera B, we are live on Periscope as well, the Twitter application Periscope. So thank you to Katie, my channel members, all rolling in on YouTube. Thank you, Osaka World, for coming in on Periscope, and welcome into all my moderators, my Patreon supporters, and everybody who supports with Super Chat, with Super Hearts on Periscope. I appreciate you guys all coming on in. Kenny TV is checking in on Periscope. We have the Seamstress on YouTube, Jack's mom, Dawny Color. Thank you so much for being here. Lonnie is in on YouTube. Meg Lowe is on both. Lisa111, thank you so much for joining. Guys, if you haven't shared the broadcast, please share it on out. Thamer, anything is possible. But again, on YouTube, guys, I'm simulcasting on Periscope here to my left. And on the right, I have my YouTube straight ahead in front of me. I'm going to be showing you guys a little bit of graphics. Basically, this outbreak has gone. I have the Center for Disease Control up. I also have the World Health Organization up. And I'm going to be giving you some visual while on YouTube through my OBS. I'm going to give you guys a visual of some of the current news reports, some of the actual numbers of what's being reported from China and all of the cases here. I think it's 15 confirmed cases in the U.S. and one is in San Antonio, Texas. So we do have it spreading in lots of different countries. Our good friend Randy Horton, all my friends from Periscope, Randy Horton is over visiting in the Philippines, and they have cases over there. So we wish everybody who's traveling or who lives abroad safety, and all you have to do is take specific precautions. And you can keep yourself relatively safe. So yes, shout out to Randy Horton in the Philippines. So I'm going to get right into it here for my friends on YouTube. We're going to segue over to a different screen, and I will show my Periscope friends. I will adjust the camera so my Periscope people can see what's going on YouTube. If you are here on Periscope to my left, come on over to my YouTube channel if you'd like. It's a little bit better of a view on the YouTube channel. It's all one word, DutyRon. Come on over. If somebody could put in the chat over there on Periscope, my YouTube channel, that would be great. Hello, Red Lotus. Good evening. Thank you so much for joining. All right, I got my earpiece in so I can hear my secondary. Dookie 4000, thank you so much for joining. Tracy, thank you for being in here. And all the great friends on YouTube and Periscope. Killer Whale, KDF, Gary Scandal, Joshua H, and everybody is inside the broadcast. So let me queue up my first presentation for you guys so you guys can see what's going on. This is a current clip that was the most up-to-date information available. And if you guys slide on over to YouTube, you could probably see it a little bit better. Hello, Agent. Why am I having trouble with that name? I have my glasses on. Argent C, good to see you. Thank you for joining. Sorry about that. It just was blurry. I don't know why. All right, so we're gonna segue over to my secondary screen here on YouTube so you guys can see what we got going on here. Give me 2 seconds.
The latest numbers at 7 p.m. on the East Coast, the number of cases worldwide moving past 65,000, deaths nearing 1,500, and also the 15th case in the United States is now being confirmed. That patient is part of a group quarantined at Lackland Air Force Base in Texas. One district in Hubei province, where there are more than 500 confirmed cases, has started wartime population control measures. That means all buildings are closed. Everyone must stay in their homes. Neighborhood associations will buy food and medicine for the residents. And those measures are expected to last 2 weeks.
There's the YouTube channel if anybody wants to subscribe.
Beyond the fight to beat the virus, another battle has broken out over how China is counting the sick. Meg Terrell joins us tonight on that. Meg?
Well, hi, Contessa. Last night, of course, we saw that dramatic spike in the number of new cases reported from Hubei province, the epicenter of the outbreak. But it turns out this is because of a change in how they're diagnosing cases. Until last night, Hubei was reporting only cases confirmed with laboratory tests. The numbers were growing by between 1,600 and 3,000 a day. Now it's also reporting clinically diagnosed cases done using chest imaging to check for pneumonia. The WHO said today many of these cases go back days or weeks, even to the beginning of the outbreak. A backlog of cases health authorities had been unable to test yet. And while they say this change will allow clinicians to move faster to provide the right care, they do also warn these numbers may pick up cases of pneumonia caused by things other than the new coronavirus. And they say we shouldn't read too much into them. And let's get more on this now from former FDA Commissioner Dr. Scott Gottlieb. Dr. Gottlieb, you were here helping us break down that huge surge last night. Now we've seen these new numbers tonight back down to 4,000 new cases. We don't yet have the breakdown as to how many of these were clinically diagnosed or confirmed with a test. But what do you make of such a smaller number than we saw last night?
Well, I think some of the thinking last night was that they were clearing out the backlog of suspected cases, and they were very suspicious and just sort of converting them to confirmed cases based on clinical findings that were consistent with the virus. The fact that the numbers went up again tonight suggests that's not the case, that they're just continuing to have growth in these numbers and that they just simply can't keep up with the PCR-based diagnostic test. Again, it's concerning because people who are being diagnosed based on CT findings, it suggests that they probably have significant findings on their chest x-rays. And flu season peaks a little earlier in China, so there's not as much background flu, and that's probably also influencing them. So people who are showing up with significant pneumonia, they're just surmising that's coronavirus.
Well, I wanted to ask you about that also because the WHO warning this could pick up other causes of these kinds of pneumonias.
Sorry, guys.
In chest x-rays, you don't think it is too much flu, so it could be mostly novel coronavirus.
It's hard to know, and there's no reason to assume that their clinical diagnosis is less reliable than their PCR-based diagnostic test, because we know that's not as reliable as well. So there's no reason to believe that these numbers aren't true and won't continue to grow. And keep in mind, they put in place their measures, the quarantine measures, on January 23rd, and they're still seeing growth in cases, and that's concerning.
We know that there's a ramped up procedure for screening people in China. Are we seeing the same thing now in the United States as we start to look at other communities that may have more influence from Chinese visitors who had been here for longer than 2 weeks?
Well, not yet. We're not looking for it yet here in the U.S. We're just screening people who have a direct connection either to people who've been diagnosed or traveled to China. They're just now starting to talk about implementing measures to do background screening of communities where there might be some spread to pick up undetected spread. And that's very important. That's the way we're going to prevent large outbreaks here in the U.S. is to find small outbreaks.
So there's reports that we may be using the flu surveillance network in 5 cities then to potentially
4,800 new cases in China.
Is 5 cities enough? What else should
and
the
I think
US
that's
be
because
doing
of the
Well,
on-the-spot
the 5 cities that we're picking,
verification
there's a lot of
testing.
travel from China, then that could potentially pick up small outbreaks. I think the other thing we need to do is try to get an approved diagnostic test kit out to laboratories. Right now, we're relying on the tests that are being promulgated by the CDC. There were some problems with that. They had to pull it back, so that hasn't been fully implemented. But there's platforms in doctors' offices that can be adapted to test for coronavirus so we can do broader surveillance.
Are we being aggressive enough right now from what you can observe?
I think we're just starting to step up the measures. I think it's very important to broaden screening. Anyone who comes in with pneumonia that's not flu and isn't an obvious viral illness and isn't the bacterial cause probably should be screened for coronavirus. We don't have the capacity to do that right now, but we could build out that capacity fairly efficiently.
So far, there have been nearly 45 the latest numbers at 7 p.m. on the East Coast. The number of cases worldwide moving past 65,000. Deaths nearing 1,500. And also, the 15th case in the United States has now been confirmed. That patient is part of a group quarantined at Lackland Air Force Base in Texas.
These numbers are
One district in
astronomical.
Hubei province, where there are more than 500 confirmed cases, has started wartime population control measures. That means all buildings are closed. Everyone must stay in their homes. Neighborhood associations will buy food and medicine for the residents. And those measures are expected to last 2 weeks. Beyond the fight to beat the virus, another battle has broken out over how China is counting the sick. Meg Terrell joins us tonight on that. Meg?
Well, hi, Contessa. Last night, of course, we saw that dramatic spike in the number of new cases reported from Hubei province, the epicenter of the outbreak. But it turns out this is because of a change in how they're diagnosing cases. Until last night, Hubei was reporting only cases confirmed with laboratory tests. The numbers were growing by between 1,600 and 3,000 a day. Now it's also reporting clinically diagnosed cases done using chest imaging to check for pneumonia. The WHO said today many of these cases go back days or weeks, even to the beginning of the outbreak. A backlog of cases health authorities had been unable to test yet. And while they say this change will allow clinicians to move faster to provide the right care, they do also warn these numbers may pick up cases of pneumonia caused by things other than the new coronavirus. And they say we shouldn't read too much into them. And let's get more on this now from former FDA Commissioner Dr. Scott Gottlieb. Dr. Gottlieb, you were here helping us break down that huge surge last night. Now we've got that also because the WHO warning this could pick up other causes of these kinds of pneumonias in chest x-rays. You don't think it is too much flu, so it could be mostly novel coronavirus.
It's hard to know, and there's no reason to assume that their clinical diagnosis is less reliable than their PCR-based diagnostic test, because we know that's not as reliable as well. So there's no reason to believe that these numbers aren't true and won't continue growing. Keep in mind, they put in place their measures, the quarantine measures, on January 23rd, and they're still seeing growth in cases, and that's concerning.
We know that there's a ramped-up procedure for screening people in China. Are we seeing the same thing now in the United States as we start to look at other communities that may have more influence from Chinese visitors who had been here for longer than 2 weeks?
Well, not yet. We're not looking for it yet here in the U.S.
Welcome in Urban Explorer and B-Lady Apiary. Thank you so much for joining, guys.
China. They're just now starting to talk about implementing measures to do background screening of communities where there might be some spread to pick up undetected spread, and that's very important. That's the way we're going to prevent large outbreaks here in the U.S. is to find small outbreaks.
So there's reports that we may be using the flu surveillance network in 5 cities then to potentially test people for novel coronavirus. Is 5 cities enough? What else should the U.S. be doing right now?
Well, it depends on the 5 cities that we're picking. If there's cities where there's a lot of travel from China, then that could potentially pick up small outbreaks. I think the other thing we need to do is try to get an approved diagnostic test kit out to laboratories. Right now, we're relying on the tests that are being promulgated by the CDC. There was some problems with that. They had to pull it back, so that hasn't been fully implemented. But there's platforms in doctors' offices that can be adapted to test for coronavirus so we can do broader surveillance.
Are we being aggressive enough?
Christina Smallhorn, welcome in. Thank you for joining.
I think we're just
Great to see you.
To step up the measures.
Just listening to a quick news report here.
Screening. Anyone who comes in with pneumonia that's not flu and isn't an obvious viral illness and isn't a bacterial cause probably should be screened for coronavirus. We don't have the capacity to do that right now, but we could build out that capacity fairly efficiently.
All right, so guys, this is spreading like wildfire, and I got to tell you, it is frightening. It is frightening to say the least. The message is the sick, the elderly, anybody that's diabetic or is susceptible to contracting a virus or any type of disease are very much more at risk here. So they're saying that, this is not something that should cause massive public alarm, but I got to tell you, even now I am paying attention to it because prior to, I'd say, the last 24 to 48 hours, I was monitoring it, but not closely. I was, paying attention. Katina Inspirations, thank you so much for being in here. Meg Lowe and all the great ones, my moderators, thank you so much for moderating. Rouse Trucking, thank you so much for coming. I'm going to get a haircut tomorrow, so I got to be nice and smooth for Valentine's Day for the missus. Urban Explorer, thank you for being in here. Urban Explorer said his van is ready to go in case of an emergency. So yeah,
Thank you for the super.
I was talking to Nick, and there is not even reporting how bad it is in Thailand. Yeah, unbelievable. It is scary to say the least. And folks, I have some info here from the CDC and the World Health Organization that I'm going to show you because I don't want people to panic. I have received lots of. I received lots of. Thank you for the super chat, by the way, Urban Explorer. I've received lots of emails and messages to do a video on the coronavirus, and I didn't feel it was necessary to do a video. And after like 50 emails, I said to myself, maybe this is what everybody wants, and I gotta do a video on it. And you know, I watched the world and nightly news and the world news tonight, and when I saw what I saw on world news, I said, oh my God, you know, there's got to be some people that are panicking about this. So I wanted to go live. Let me see what here's a second thing. I want you guys to see this right now. Hold on a second. Stand by. This is give me 2 seconds. I want to get my mug out of it. So give me a second to set this up. I know I got a dark screen. Okay. There we go. Let's play this.
The coronavirus. The State Department raised the travel advisory for China to level 4. That means they are urging Americans to avoid all travel to China. And this comes after the State Department authorized the departure of non-emergency personnel and their families from embassies and consulates.
You see that? It says, do not travel to China.
The U.S.
This
will
is from
also
January
be staging
30th.
additional evacuation flights from Wuhan for private U.S. citizens. The flights will take place on or about February 3rd. Interested U.S. citizens with valid passports should contact the State Department with the information that you see on your screen right there. Meanwhile, the World Health Organization declared the coronavirus outbreak a global health emergency. The WHO's Director General said the main reason for the declaration is not because of what is happening in China, but because of what could happen in other countries.
Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.
WHO's Director General says the organization continues to have confidence in China's capacity to control the outbreak. More than 200 people have died in China from the illness. Nearly 10,000 have been infected worldwide, including 6 people right here in the U.S. And health officials confirm that the newest patient in Chicago got it from his wife. That is the first known person-to-person transmission confirmed here in the United States. So CBS This Morning lead national correspondent David Begnaud is outside of a hospital that is ready to treat patients suspected of having the virus. David, what have you learned so far?
Christina Smallhorn, thank you so much for that super chat. Christina says, do you believe this is something we should be preparing for in our homes, like real possible crisis? Well, let me tell you, China is like a military zone right now. They have everything shut down. Beach Street, thank you so much for the super sticker. Thank you for that super love. Again, there's no need to panic, but what we need to do is keep ourselves educated. Keep yourself aware of your surroundings. If someone's coughing around you, there's no need to hang around someone that's hocking up a lung near you, and try to avoid public places. There's a lot of us that have to travel in the subways to go to work. And, I know you're in the real estate field, so you're around a lot of people. But if you see somebody that's sick, you got to try to limit your exposure. But this is not in any way, shape, or form here in the United States at epidemic levels like it is in China. You got people, in the hundreds being diagnosed overnight. So it's dangerous. And like they just said here, third world countries and countries who don't have good healthcare systems in it, that's where the concern comes in, where this could spread, again, like an epidemic and, spread like wildfire. My wife is the same way, Christina. She hates germs, and we try to stay out of the public. And when there's people coughing or anything like that, we kind of skedaddle away even without this on the plate. So I don't think here in the United States we have anything to tremendously worry about. But it is of a concern. It's a concern enough for me that I'm gonna do a live stream here, and I'm gonna also show you guys the CDC and the World Health what they're recommending you do as far as like a high level of hygiene and how to keep yourself, how to take the preventative measures to limit your exposure, because it is person to person, it is airborne. So I think a lot of us are germ freaks, but now more so than ever. So let me continue with this.
This is the Loma Linda University Medical Center. They are a level 1 trauma center, the only one really in this area. And they're not very far from that Air Force base, or the reserve base actually, where more than 100 Americans arrived by flight about 48 hours ago. And they are being held on that base. They've been told it's voluntary, but actually somebody tried to leave yesterday. And
okay, so it says this marks the first time person-to-person transmission has been confirmed in the United States.
That plane was coming in here. They went ahead and activated their tent area outside. They've used this for flu in the past, flu outbreaks, but they're using it for coronavirus now. So when you come in, what they have are some chairs, the one bed here. They can bring in more, some cots, just a triage area. And Anne-Marie, one of the first things they do is take your temperature. Coronavirus symptoms are very similar to the flu: cough, fever, shortness of breath, those type of things. So Loma Linda is ready.
Thank you first, Olga. Olga. I think I got that right, Olga. Thank you for that.
Whatever's in here goes out, and only fresh air comes in. So it's incubated, so to speak, safe area. They'd rather you come here if you have symptoms rather than go into the ER. So just one example of what a hospital is doing, because they are so close to where those folks arrived from China.
Right. So I mentioned leading into you about this new case in Chicago where the gentleman got the virus from his wife. What do we know about that case?
Yeah. So here's what we know. She went to China in July. She came back. He got the illness from her. He did not travel to China. She is currently in the hospital. I'm sorry, what are you saying? Yeah, December. What did I say? July. Oh, July. I meant December. The wife went to China in December, came back, had the virus. The husband then got it from her. Both of them are hospitalized in Chicago. She is listed in very good condition. That's what the CDC said yesterday. He is also in the hospital. He's listed in stable condition. What the health officials in Illinois are doing right now is finding out if he went to any public areas, right? Was he around large groups of people? And do they need to contact those folks as well?
Yeah, that's the thing about this virus is that, collectively around the world, we're all learning about what it's capable of sort of in the moment. And we know that the World Health Organization declared, this to be sort of a public health emergency of international proportions. And that's part of the reason. I know sometimes people look at the numbers and they go, oh, so many people die of the flu than, the coronavirus, but it's that we really don't know where this is going, what it's capable of.
So that's a good point. In fact, I was on the conference call yesterday with the CDC, and one of the questions asked to them is, can you detect coronavirus before someone starts showing symptoms? And the answer was, we don't know. There's a lot that officials don't know. So yes, contextually, when you put it in context, the flu is far more problematic, if you will, than coronavirus. However, there's a vaccine for the flu. There's a protocol. They're used to it. They do it regularly. This is something brand new. So even though we only have 6 cases in the United States, there was an entire conference call that the CDC had where members of the media were allowed to get on yesterday. And let me give you some context from there. They did not sound panicked at all. In fact, the head of the CDC and the number 2 was like, listen, we know what it is. We know where it's happening. We're in touch with every single health department. They all sounded very cogent and clear in the directives they were giving. And they also said the public does not need to wear masks as of right now. We are not advocating for that. We do not think the public should panic. We are monitoring everything very closely. And listen, that's a pretty extreme step that the U.S. State Department took in saying do not travel to China at all. For context, they have said in the past, restrict your, when it comes to SARS
at this time, Cruise Boston. I don't know that
in the past, but that's a pretty stern warning, if you will. Don't go at all, but that's what they think is best right now, to just avoid trips to China.
All right, David, thank you so much.
Viewers in the West, a train carrying deadly chemicals derailed.
All right, so I got one more thing, actually two more things I want to show you. This is going to be from advice for the public from the World Health Organization. I'm going to go to CDC first. CDC has some really good info on the coronavirus and how it spreads. So right here is just a, let me see if I can get this full screen. Hold on, guys. Shit. It's not sizing right. I don't know why. Okay. Well, I'll read this to you guys. So it says, how does the coronavirus spread? Much is unknown about the coronavirus. New coronavirus spreads. Currently, the knowledge is largely based on what is known as about similarities in coronavirus. Coronavirus are a large family of viruses that are common in many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can affect people and then spread between people, such as MERS, SARS, and now with the 2019 nCoV. Most often spread from person to person, happens amongst close contact about 6 feet. Person-to-person spread is it's thought to occur mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how the influenza and other respiratory pathogens spread. These droplets can land in the mouths or nose of people who are nearby or possibly be inhaled into the lungs. It's currently unclear if a person can get coronavirus by touching a surface or an object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. So that's basically what they're saying. This is straight from the CDC, and then it goes over symptoms and complications and testing. But I want to show you the World Health Organization. They have actually a press briefing. That's what I want you to hear. You know what? Let's see how this comes across.
Hello again from Geneva.
This is a press briefing.
Apologies for the delay. We have our guests
this
today.
is from today.
Ryan,
so this is going to be good. I'm going to let you guys listen to this.
And for the first time on the panel, we have Dr. Oliver Morgan, Director of Health Emergency Information and Risk Assessment here at WHO.
How is the volume?
As always,
can you guys hear this okay?
Audio file immediately available after the briefing, and transcript will be available tomorrow in the morning. We will keep this press briefing short, so
Meanwhile,
I will
there's
remind
someone
again
coughing in the background.
journalists to ask only one question, so we can get as many as possible. For journalists online, please click raise hand to be put in a queue for questions. And
given the land in the Democratic Republic of Congo, where he's following up on important Ebola matters and meeting with President Tshisekedi and many others to look at the future post-Ebola of the health system in Congo. I'm sure you'll understand how important a task and a mission that is.
Thanks, Ray D. Pour me a drink if you can, please.
Congo and the
Pour yourself
ongoing
one, too. Let's get a drink.
Struggles in that country to deliver effective health care and reduce suffering and mortality from how cases are being diagnosed and reported. So, in other words, in Hubei province only, a trained medical professional can now classify a suspected case of COVID-19 as a clinically confirmed case on the basis of chest imaging rather than having to have a laboratory confirmation. This allows clinicians to move and report cases more quickly, not having to wait for lab confirmation, ensuring that people get to clinical care more
so they're just
quickly,
talking about the cases
and also
how they're diagnosing them,
contact tracing, and other countries with weaker health systems, and ensuring that preparations are made and there's good coordination between ourselves and the European Union and our WHO regional office for Europe. And we very much welcome the strong support from the European Union in supporting countries with weaker health systems and ensuring that other countries have the investments and support needed to prepare for the arrival of the virus. In terms of the international mission, the advanced team and their Chinese counterparts have now finalised the scope of work and design of the mission, and we expect the rest of the international team to start arriving in China over the weekend. Thank you. Back to you, Tariq.
Thank you very much, Dr. Ryan. Just to repeat again for journalists dialing in, it's a star now.
We might see a few more deaths in the younger age groups, but it's
severity is amongst men rather than
here's
women,
the information about children, the young.
That profile is very much repeated.
He's going to talk about
in other areas
the age
outside
groups
Hubei,
of affected
in
people
in other provinces and administrative regions. Hong Kong has a very similar pattern of severity and age. Singapore has a very similar pattern. In fact, we're seeing quite a similar pattern around the world. So Oliver may wish to add. He's more in tune with the daily data.
No, as Dr. Ryan said, we haven't seen any major changes yet. We're still obviously following up that closely. As we have a larger number of deaths, we might see a few more deaths in the younger age groups, but it's still predominantly in the older age groups, older 60, 70, 80 years old.
Yes, please, and sorry for yesterday.
Thank you. Yang with Xinhua News Agency. There were 9 thematic areas at yesterday's forum. So which are the most pressing ones, and which research institutions are now doing what jobs exactly in this regard?
Health conditions, or are you seeing any signs that the younger and the healthier are being hit?
No, we're not seeing a significant shift in the pattern of
So
mortality
no young
or
and
severity
no healthy
for that matter.
people are
this disease is still predominantly severe in those who are over 40, with a higher severity profile that increases actually with each decade after that, and predominantly too that severity is amongst men rather than women, and we haven't seen a significant shift. That profile is very...
So more men than women and above 40, and as the decades go forward, 50, 60, 70, it increases the percentages, but really no profiles in the younger ages and healthy. But above 40, and if you are, weakened immune system, diabetes, autoimmune type diseases, or issues, and that's a concern. But again, it's being spread by coughing and airborne type spread. So let me just see something here. Hold on. Got one more thing for you guys. I always save stuff and then I screw it up. So there's a picture inside of China. It looks like it's in a public place. This is before they locked down China. And you see everybody with the masks. It doesn't look pretty. I'll tell you that right now. Hello, Nona 617. It doesn't look pretty over there in China. It looks like, it's, you see a little kid there with the mask, a couple of little kids, and everybody's masking up. And I don't know what those masks will even do, to be honest with you. I wanted to send you a drink, says Ann Collins. I'll take a Tom Collins, Ann Collins. Yeah, it was just a running joke between me and Ray. We've been talking about having drinks for 4 years now between Periscope and YouTube. So, how did I put that? This isn't it. Advice for public. Oh, this is it. Oh, okay. This is what it is. I never give up. I never give up. This is what I want you guys to see.
There are several measures you can adopt to protect yourself and others from getting
This is from the World Health Organization.
Frequently clean your
Soul
hands
for music,
by
good to
using
see
an
you.
alcohol-based hand rub product like a gel, or wash your hands with soap and water. When coughing and sneezing, cover your mouth and nose with flexed elbow like this, or use a tissue. If you use a tissue, discard. There are several measures you can adopt to protect yourself and others from getting the new coronavirus. Frequently clean your hands by using an alcohol-based hand rub product like a gel, or wash your hands with soap and water. When coughing and sneezing, cover your mouth and nose with flexed elbow like this, or use a tissue. If you use a tissue, discard it immediately into a closed bin. Avoid close contact with anyone that has fever and cough. And if you have fever, cough, and difficulty breathing, seek medical care early and share information about any recent travels with your healthcare provider. If you just have mild respiratory symptoms and no specific travel history, carefully follow the precautions I just explained and make sure you stay home until recovery. If you need more information on how to protect yourself from the new coronavirus, check the WHO website at who.int.
So that was from the World Health Organization. Some good information, but basic stuff that I think we all know. So I'm going to end the video now. I'm going to segue back onto me. I just want to say, if you're new and you haven't subscribed to my channel, it's all one word, DutyRon, on YouTube, Periscope, Instagram, Facebook, and Twitter. All one word right here, DutyRon. Subscribe to my channel here. Hit the notification bell so you'll get everything DutyRon. I want to wish all of my good friends and the young ladies and the ladies of all ages out there, because I'm not young, I'm in my mid-50s. So I want to wish all of my women out here today, tomorrow. And if it is tomorrow where you are, happy Valentine's Day. I'm wishing you guys a lot of love and peace and health, and first and foremost, health. So I want to say happy Valentine's Day to all the ladies, to all of my friends and people who are loyal and follow me and come on when I go live. I greatly appreciate you guys, and I wish you the best. The information that I shared here with you tonight is not for my benefit. It's for all of our benefits. And I got so many emails. I counted 50 different emails over the course of the last month asking me to please do a coronavirus video. I just didn't think that, at the early stages of the game, I didn't think that it was necessary to do it. But now I feel it's necessary. It's something that I'm concerned about. I'm not freaked out over it. Thank you for subscribing, Neela Sampson. Thank you so much for subscribing. Appreciate that. So again, I want to say thank you to all you guys, my Patreon supporters, my channel members. You could see the channel memberships in the bottom. Those are all the people in green coming across on the video. In the chat, you could see the names are highlighted in green. Those are my channel members. I want to say a special thank you to you guys. My moderators who do it for free, I thank you. All of the young ladies and all of the people who shop on my Amazon affiliate website. When you go over to my Amazon affiliate and shop, it doesn't cost you anything. It's not more or less. And a small portion of that goes to supporting this channel and keeping it going. I always update and buy a lot of equipment. I'm going to go to the Thomas Valva opening statement criminal case when that happens, when they finally get a jury and the trial goes. I'm going to bring that live coverage outside of the courtroom, from the parking lot probably, or from the courthouse, and some updates in regards to that. There was a hearing today in family court. They made Justina wait until 2:15 until they had a hearing, and they brought both of those savage murderers out, and she was standing just a short distance away from the two of them. And he pleaded for time to get an attorney, or said he couldn't afford an attorney, a bunch of bullshit. And it's just a mumbo jumbo of legal stuff that they have to go through. But she will have full custody of those children, and that is a fact. And you can bet your bottom dollar that no court is going to take those kids away from Justina, her two surviving children. They're just dotting their I's and crossing their T's and going through the process. They're going through the process, and the courts are now doing it to the letter of the law, but they're not going to screw her over. I won't get another ticket, Trevor. You remember that. I got a ticket when I went to Karina Vetrano's trial. But she's going to get the kid. She's going to get full custody of the kids. She has them there with her, just like she has full custody. It's a formality. It's temporary right now. But once she goes through all the process, which today she agreed upon the court-appointed psychologist to see, to counsel the kids, like sexual, to see if they were assaulted sexually, to see if there was anything wrong with them. It's just a step that she has to go through. And she said initially no to it, but then the judge was able to convince her to agree to it, and she agreed to it, which is great. So she will have, in a short period of time, custody of those kids, full custody legally, and it will be good. So again, guys, much love and respect from my house to yours. As always, I wish you guys all well. To my men who follow me, happy Valentine's Day to you as well. I'm wishing everybody health, happiness, and success always going forward. So no matter what your situation is, whether you have a significant other or if you don't, Valentine's Day is for everybody, and it's all good. You definitely have a friend here with me and everybody in the chat, so you always know that you could come over to us and have a friendly conversation and never get attacked here in my live stream. So 42 minutes. I'm overstaying my welcome. Have a great evening. Thank you for joining, and stay safe, stay healthy, and I will speak to you on the next live. So thank you to all. God bless and good night. Peace.